This is another topic, conjunctivitis, that we've diagnosed patients day in, day out. And sometimes we get into a motion of pattern recognition, and there's room for errors at that point. This is day 3. This is a patient in the ER today. We had an opportunity to take care of him on Thursday and Friday at the primary care doctor's office. Tanya Reynolds says blind, pseudomonas. And you know what? That's exactly what was my thought. I said, this guy's lost his eye. Conjunctivitis gone bad is what I'm looking at this, right? It's a run-of-the-mill conjunctivitis. We treat hundreds of them, and then one goes bad. Obviously, this is not the run-of-the-mill conjunctivitis. Otherwise, we would not be talking about it today. Basically, a 42-year-old gentleman that was diagnosed with conjunctivitis by their primary care doctor. Basically came in on a Thursday, I believe it was, for red eye, and diagnosed with conjunctivitis. They put him on a antibiotic ointment. So this patient basically calls back the next day to the primary care doc and essentially says, I'm not getting better. It's getting worse. So I guess, what are your thoughts at that point? I think some of us are saying, did you even take the antibiotic ointment that I prescribed you? Or are you using it the way I told you? Or, what are some of the questions that goes through your mind when the person calls and says, I'm not getting better within 24 hours? So what do you want to do? Do you want to see the patient again, or you just say it's only 24 hours, continue with the antibiotic ointment, or send it to the ophthalmologist? Probably the option at this point on a Friday late afternoon is, I don't think you're going to get an ophthalmologist. I think this patient's going to end up going to the ER. So this patient's video clip I will share with you. What do you think he's got now? Let me show you this clip now. Same patient, same day. He cannot open his eyes. If you look at it, he is not able to open his eyes. And that is probably the most critical piece right now. Epidemic keratoconjunctivitis is what he's got. EKC in short. And so now the question is, which of the following will help you make a clinical diagnosis of keratitis? Basically, infiltration, infection of the cornea, not just the conjunctiva, but the cornea. So keratitis. So what situations are you going to say is going to help you differentiate this eye's keratitis and this eye's bacterial and or viral? So of these 4 options, if you can pull the questions, which one of these will help you say it's keratitis? I kind of jumped the gun and showed you the video clip, right? And I was making it very clear on the video clip that I'm not able to open his eyes without support, without prying it open. And that is very specific. It's not specific. It's very highly indicative, suggestive of keratitis. The keratoconjunctivitis is caused by what? Is it traumatic? Is it bacterial? Is it viral? A, B, or C? So most of us picked 50-50, just about viral and bacterial, and some pick traumatic. So if it's epidemic, I'm automatically just taking good exam skill sets. Epidemic cannot be traumatic, done. So it's got to be A or B. So it is A, viral. So it's caused specifically by adenovirus 8/1937. This virus, for whatever reason, attacks the cornea, usually few days after the initial conjunctivitis. And this is the kicker, right? So we see patients in our health center. I've seen patients, as an outpatient. I made diagnoses of people on the phone. I've treated people on the phone. And so have you, and you guys are going to deny it today. But we've treated people on the phone, say, oh, you got the pink eye. Let me just give you this antibiotic. You'll be fine. So these are people that we treat very sort of casually, but then we need to keep in mind, there are some that don't get better, and we need to keep an eye on them. I made a list of things that I feel and some of the literature says that requires an urgent ophthalmology referral. All right, these are things that we just don't want to sit on. Is basically anything that causes a decrease in the visual acuity in the office. You need to start thinking about: is it keratitis, a little bit of opacification? Is it iritis, or is it glaucoma? All right, those are some of the things that will cause decreased acuity of vision. Your normal conjunctivitis will not. So in our exam, when we're doing the pink eye diagnosis, I think we should be saying no visual change. We should be saying no significant photophobia. We should be saying does not feel like there's any foreign body in the, so these are the things that will rule out other things or help rule out other things.